Welcome. If you're watching this, it probably means your back pain has been affecting parts of your life. Your work, your exercise, or even your confidence in moving. Before we begin, I want you to hear this clearly. Your back is not fragile, and improvement is possible. This program is designed to help you understand your back pain better, build confidence in movement, and decide whether you are ready to manage this on your own or whether some structured support may help you move forward faster. Today we will focus on 3 things: building confidence, building physical capacity, and helping you regain control over your back pain. This video is intended for education only. It is not a substitute for medical advice or diagnosis. If you have concerns about your condition or are unsure about your symptoms, please consult a doctor or qualified healthcare professional. Seek medical attention promptly if you experience severe worsening symptoms, significant weakness or numbness in your legs, changes in ability to pass or control your urine or bowel movement, fever, unexplained weight loss, or recent trauma.
Let me start with a story. A few years ago, I met someone who had been struggling with back pain for several months. He had already seen multiple clinicians, he had an MRI scan, and he had been told that he had a disc problem. After hearing that diagnosis, he became very cautious with his back. He stopped exercising, he avoided bending, and he became increasingly worried that he might damage his spine further. But something interesting happened. When we gradually helped him return to normal movement and rebuild confidence in his back, his pain slowly improved. Not because the scan changed, but because his body regained confidence, strength, and tolerance to movement. This story is actually very common, and it highlights an important message. Recovery from back pain often begins when we change how we think about movement. Back pain can feel worrying, especially when it appears suddenly or prevents you from doing activities you normally enjoy. For some people, the pain settles within a few days or weeks, but for others, it may last longer or it keeps coming back. Sometimes back pain can persist for several weeks or even more than 1 month. When that happens, it is very natural to start wondering whether something serious might be wrong. Many people begin asking themselves questions like, did I damage something in my back? Or should I stop moving to protect it? These concerns are completely understandable. In fact, almost everyone with back pain has had these thoughts at some point. What is important to know is that when back pain lasts longer than expected, it does not automatically mean that something serious is happening inside the spine. Often, it simply means the body and nervous system are still in a protective phase. And with the right understanding, gradual movement, and the right level of support, most people can still make meaningful progress. In order to overcome back pain, we need to first understand the specific role pain has in the human body. I will try to explain the purpose of pain and how low back pain works in the body in just 1 minute. One helpful way to understand pain is to think of it as a protection system. Your body produces pain when it senses potential threat. Sometimes that threat is injury, but sometimes the system simply becomes more sensitive. When that happens, even normal movements may feel uncomfortable. This does not necessarily mean your back is damaged. It may simply mean your body is trying to protect you. Have you ever been through a fire drill before? Think about a fire alarm that senses smoke. The alarm is designed to protect you, but sometimes it becomes too sensitive and it goes off even when you burn toast or if someone smokes in the room. The alarm is real, but the house is not on fire. Back pain can behave in a similar way. The pain experience is real, but it does not always mean damage is occurring. People believe that once they receive a diagnosis, that diagnosis determines what they can or cannot do. For example, someone might be told to avoid bending, avoid lifting, or avoid certain movements or sports entirely. You cannot ever lift more than 5 kilos again. You have a back of an 80 years old man. Do not even think of playing golf again. But back pain is highly individual. I say again, two people can receive the same diagnosis, yet experience very different symptoms, triggers, and abilities. A diagnosis can guide treatment, but it does not define what your body is capable of. Most of the time, your body is not as fragile as how you imagine, and the state of your back will be determined by what you do about your back pain. Thus, the aim of rehabilitation is to improve your function, confidence, and tolerance to movement, regardless of the specific diagnosis. Many people believe that imaging can identify the exact cause of their low back pain and tell them how to fix it. In reality, imaging often does not change treatment or improve outcomes. Findings like disc degeneration or bulges are very common even in people who have no back pain. For example, around 37% of people in their 20s already show disc degeneration. Around 96% of people in their 80s show the same. This means that structural changes seen on scans are often a normal part of aging. The degree of change seen on imaging also does not always match a person's symptoms. Someone with a large disc herniation may have very little pain, while someone with minimal changes may have significant symptoms. So, you might ask, who then needs an X-ray or an MRI scan? The next few slides are here to help you understand when scans might be needed. In most cases, back pain does not require imaging. However, there are certain situations where a doctor may recommend an X-ray or MRI to rule out more serious conditions, such as fractures, infections, inflammatory conditions, or more rarely, tumors. Imaging may also be considered if your symptoms are not improving as expected. In the next section, I'll walk you through what signs to look out for and when it would be important to seek medical advice. Less than 1% of people with back pain have a serious condition called cauda equina syndrome. Although it is rare, it requires urgent medical attention. You should go to the emergency department immediately if you experience numbness around the groin or saddle region, new problems with bladder or bowel function, such as difficulty passing urine, loss of control, or reduced sensation, new changes in sexual function, increasing leg symptoms affecting both sides or symptoms that alternate between sides, or new weakness, numbness in both legs, or changes in your walking. If you notice any of these symptoms, seek medical care immediately. Some may present with low back pain after a spinal trauma, or they have a systemic disorder. Go to the emergency department if you had a recent severe trauma to the lower back, like a bad fall or accident, or have an ongoing fever, chills, and experience constant pain even at rest that does not improve with movement, or unrelenting night pain or sweating. Seek non-urgent medical attention, either at the polyclinic or the nearest family doctor, if you experience low back pain together with loss of weight or appetite, have a personal or family history of cancer, or waking up in the morning with back stiffness that lasts more than 30 minutes. These symptoms suggest a need for a medical examination to check for serious underlying conditions that might be linked to your back pain. Having low back pain with numbness and weakness in the legs is more common. These symptoms suggest that you might suffer from radiculopathy or sciatica. Seek non-urgent medical attention at the polyclinic or nearest family doctor if you have low back pain with or without buttock pain, pain and numbness radiating from the buttock to the leg. You may have weakness in the leg or foot. As these symptoms may sound like cauda equina syndrome, ensure that you do not have numbness in the groin or saddle region, you can still control your bladder and bowel since the pain started, and there is no sexual disturbance experienced. After receiving all this information, you might wonder, what could be the cause of my lower back pain? We will explore a few common questions that we commonly face from patients. We hope that the answers can enable you to make better decisions behind low back pain treatments. After hearing this information, you might wonder what actually causes low back pain. Let's begin with posture. It is very common to blame low back pain on posture, but research does not strongly support the idea that one posture is inherently better or safer than another. Someone can have poor posture and no back pain, yet the opposite is also true. Aches still come despite maintaining a good posture. That does not mean posture never matters. If a particular position currently aggravates your symptoms, it can be helpful to modify that position temporarily. The concern arises when people begin to permanently avoid certain positions or obsess over posture because they believe it is the primary cause of their pain. For example, if sitting for long periods increases your back pain, the issue may be related to the position of your spine. However, it may also be related to a lack of movement, prolonged inactivity, stress related to work, or other contributing factors. Possible solutions could include adjusting your sitting position, standing up periodically, or taking short walking breaks. These strategies introduce movement and variation rather than focusing exclusively on maintaining a specific posture. The same concept applies to standing. Some individuals actually feel worse when they constantly try to sit or stand perfectly upright because they have been told that slouching is harmful. Being sensitive to certain positions or movements does not necessarily mean those positions are inherently harmful. Another common belief is that back pain is caused by a weak core. Research does not strongly support this idea. This belief sometimes leads people to constantly brace their core muscles in everyday activities. While bracing may be useful when lifting very heavy objects, it is not necessary for most daily tasks. Your body is usually capable of stabilizing itself automatically. The goal is not to hold tension constantly, but to move naturally and comfortably. As a physiotherapist, I often meet people who have been dealing with back pain for years and feel frustrated or discouraged because they have not found the one perfect solution. Some patients whom I met said, "Physiotherapy does not help. The exercises given did not cure my back pain." They may have tried focusing on correcting posture, core stability, muscle imbalances, breathing techniques, and many other strategies. When these approaches do not lead to immediate results, it can create feelings of hopelessness. The truth is, quick fixes for low back pain rarely exist. Rehabilitation should not make you feel guilty or inadequate. Instead, it should provide you with the knowledge and tools to become more confident, capable, and resilient. Rather than searching for a perfect solution, it may be more helpful to identify possible contributing factors and address them gradually. More importantly, more and more research with long-term data seems to support this direction of rehabilitation for a more long-lasting effect for lower back pain. Now that we know that posture, core exercise are not magic bullets, what's next? It can be helpful to ask a different question. What small changes could help my body tolerate life better? This might include adjusting certain activities temporarily, breaking up long periods of sitting, increasing physical activity gradually, or improving aspects of overall health. Recovery often happens through many small improvements working together over time. Pain is not only influenced by the body, it is also shaped by how we think, feel, and what is happening in our lives. Things like stress, anxiety, or low mood can increase how sensitive the body becomes to pain. At times, it is also natural to worry about pain or imagine the worst, especially when it persists. Difficult relationships or major life events can add to this load, even if they seem unrelated to the back. Over time, these factors can make pain feel more intense, last longer, and affect daily function. Understanding this does not mean the pain is just in your head. It simply means that addressing both physical and life factors can help support recovery. You might be wondering why exercise would help if your back already hurts. Exercise improves strength, circulation, and your body's ability to tolerate movement. Over time, exercise also helps the nervous system become less sensitive to movement. In other words, exercise helps your body rebuild confidence and rebuild tolerance. If you didn't already know, participating in regular exercise releases natural chemicals in the body to reduce your pain, make you happy. Have you heard of this phrase, exercise is medicine? Many people imagine recovery as a straight line, getting better a little every single day. But real recovery rarely looks like that. There will often be good days and more difficult days. Symptoms may increase after activity, stress, or poor sleep. This does not mean that recovery has stopped. What really matters is the overall direction over time, gradually building better confidence, better function, and a stronger, more resilient back. When you begin exercising, you may notice some mild discomfort. This is common during recovery and does not necessarily mean that you are causing harm. This is also especially true if you have never exercised before or have not done any exercise for a few weeks to months. A helpful guideline is this: mild to moderate discomfort during exercise can be acceptable as long as symptoms settle afterwards and do not continue to worsen. Learning the difference between discomfort and danger is an important part of recovery and regaining your independence and control over lower back pain. Recovery often becomes clearer where we focus on a few simple principles. There are 3 skills that tend to make the biggest difference. 1. Staying active. 2. Pacing yourself. And 3. Gradually building capacity. None of these are dramatic. None of them require perfection. But they do require consistency. You might think of them as habits rather than treatments. Let's start with staying active. When pain shows up, it's very natural to rest more. Sometimes, short rest is helpful, but prolonged rest often makes the body feel stiffer and less confident. What research consistently shows is that people who remain gently active tend to recover better in the long run. That doesn't mean pushing through severe pain. It means allowing tolerable movement. Walking can be a very good starting point. Not fast, not far. Just regular movement sends a quiet message to your system to say, I'm okay. Now let's talk about this skill called pacing. You might notice this pattern. On a good day, you do a lot, but on the next day, your back pain flares. Often, this flare takes a short while to go away. Unfortunately, this same story can happen again and again, which leads you to think, it must be unsafe to try again, or I must have damaged my back this time. You end up completely avoiding all activities. This pattern is called the boom and bust cycle. It can make recovery feel very unpredictable. Instead, you might try or experiment with a pacing strategy. We call it a time contingent pacing strategy, which means doing slightly less than you feel capable of, but consistent. You will then increase gradually, like week on week. This strategy is like small increases over time, allowing your tissues and nervous system to adapt and get used to the same activity. What you don't need is a dramatic improvement. You're looking for sure but steady ones. You're investing in your health and recovery from pain with gentle but sure returns. The last skill is building capacity. When we say building capacity, we are simply saying that the mind and body needs to develop strength and tolerance over time. Strength training does not have to be complicated. You can be empowered to learn the basic skills. Basic movement patterns like bending, squatting, hinging, when done regularly, are often enough. The body adapts to what we repeatedly do well. However, if we repeatedly avoid load and activities, tolerance reduces. You know what might happen on a bad day? You hurt yourself. But if we gradually increase load and activity, tolerance improves, and you will find that it only gets easier over time. One more important thing to note: you don't need to feel completely pain-free to begin. You need a starting point, one that feels manageable.
If you are new to resistance training and would like to learn more about strengthening exercises to build capacity, ActiveSG is the perfect place to start. Just scan the QR code to begin. ActiveSG and Active Health offers many effective and fun programs catered to people of different age groups. And I have just listed some programs that is related with building strength and improving your physical capacity. Please read from their website to understand more about the cost, frequency, and commitment that is required for each program.
As you become more active, you may occasionally experience flare-ups. A flare-up is simply a temporary increase in symptoms after a period of calm or remission. Flare-ups can range from mild to severe. It is a very common part of recovery. However, it does not necessarily mean that damage has occurred. Still, you should keep an eye on symptoms, refer to the page on warning signs to check for concerning signs that will prompt you to see a doctor. Flare-ups can be related to the amount and intensity of your daily activities and exercise, or even be related with the recent bout of insomnia, stress, and sickness. Sometimes, you cannot even find a meaningful link to anything you have done. What is most important is, when symptoms increase, it may help to reduce activity slightly, continue gentle movement, and allow symptoms a few days to settle before gradually returning to your usual activities. Remember, you do not have to wait until you are completely pain-free before resuming your program. You might even want to consider painkillers to tide you through this more difficult few days, which is completely understandable. If this is your first flare-up, you will usually be more worried. You might want to see a doctor or physiotherapist. For others who have such experiences before, they can easily navigate their way around such setbacks successfully. During a flare-up, be kind to yourself. Take one step back from where you are. What I'm encouraging is not complete bed rest, but to reduce the triggers temporarily. Before we move to the next step, I'd like you to pause for a moment. On a scale from 0 to 10, 0 meaning not confident at all, and 10 meaning completely confident, how confident are you that you can stay active even if some discomfort is present, progress your exercises gradually and safely, and manage flare-ups calmly without stopping everything? Take a moment to choose a number. There's no judgment here. Now reflect on your score. If you're around 7 to 10, that suggests you likely have enough understanding and confidence to self-manage effectively. If you're around 4 to 6, that may mean you understand the concepts, but you might benefit from structured guidance to build consistency and accountability. If you're below 4, that's completely okay. It simply suggests that more support right now may help you build that confidence more safely and efficiently. Confidence matters. Research consistently shows that people who feel more confident managing their pain tend to recover better. So this score isn't really about labeling you. It's about helping you choose the right level of support for where you are today. You've now learned that back pain is common, and recovery is not about finding a quick fix, but about building confidence, capacity, and control. You've also seen that movement is safe, progress is not always linear, and small, consistent steps can make a meaningful difference. The next step is to start using these principles to overcome your back pain. In the next section, you will find the necessary resources to support you, including 3 things. 1. The CONNACT Back Scorecard to track your own progress. 2. A graded walking program. And 3. Some helpful resistance exercises to build strength and confidence. Take your time, start at a level that feels manageable, and progress gradually. Your recovery starts with small steps. And if ever you feel that you need someone to guide you and find support in a group, you can sign up with the community partners that we have worked with to see through this program alongside you safely and effectively. You've now learned that back
Let's begin. These resources form the CONNACT Back self-management resources that is free for all participants. As part of this program, you should complete a set of short questionnaires that form the CONNACT Back Scorecard. This includes tools such as the Oswestry Disability Index and the EQ5D5L. The scorecard helps you understand how your back pain is affecting your daily life, your movement, and your overall well-being. By completing it at the start and again later, you can clearly see how things change over time. Sometimes progress is not always obvious day to day, and this helps make those changes more visible. It also helps you reflect on what is improving and where you may want to focus next. Step 2 involves starting a walking program to ease back pain. Walking is one of the most convenient exercises to reduce back pain. All you need is to get out of the house to get going. You can use this guide to suggest a suitable starting point for walking. What is really important is that for an exercise to be effective, the dose is important. In this situation, the intensity of exercise is key. Based on this table, the intensity guide will describe the experience you are feeling when walking. If you can sing a song while walking, this is considered low intensity. As the weeks progress, you can see that the intensity of exercise increases. Once you pick up speed over the weeks, you will find that you might be able to only speak short sentences due to feeling breathless. This is a normal response to exercise, and this is considered moderate intensity. This method of tracking your intensity is called the talk test. The next slide will demonstrate the difference between 3 different intensities. You should also use the QR codes to review Singapore's physical activity guidelines in 3 different languages to understand how much physical activity is recommended for you. Take some time to read the infographics to understand better, and don't forget to start walking. As you start your walking exercise and beginning to feel good about that, the next step is to build strength and resilience in your musculoskeletal system. Resistance exercises can improve your strength, range of motion, and function. If you cannot move well or pick something up from the ground confidently, strengthening exercise will get you through this. Adhere to this set of exercise progression to see a slow but definite improvement in your strength and range of motion over 3 months. These exercises are specifically helpful only if they are done with control. If you're unsure that you're doing it correctly, skip the specific exercise and focus on the rest of them. Otherwise, you can change your mind and participate in the guided program at our community partners. As you get better and wish to perform these more regularly, take note to avoid performing these exercises on consecutive days if you are feeling tired. When these exercises no longer feel challenging for you, you have the choice to go to Active Health website to sign up for more resistance training to achieve a better result. To combine the walking and resistance training in one holistic program, this is how it is going to look like, from the early, middle, and to the end of 3 months. At the end of 3 months, take a new CONNACT Back scorecard and complete it again. This allows you to reflect on your progress in your quality of life, your ability to perform daily activities, your level of back pain, your movement, and how much walking or exercise you are doing now. Take a moment to compare your scores. Notice what has improved and where there may still be room to grow. If you've been able to follow the program consistently, you've taken an important step in managing your back independently, and that is a meaningful achievement. If you found it difficult to follow the program, that's completely okay. You can revisit your confidence in self-management and reflect on what may have made things challenging. Sometimes, changes in motivation, support, or life circumstances can influence how we engage with recovery. This can help guide your next step, whether continuing on your own or seeking additional support.